Good evening, everyone, and welcome to our another series of HCH Education Series. Today, we have a very renowned pulmonologist, respiratory physician from the eastern part of the country, Kolkata. We have Dr. Unithan with us, who is an alumnus or MBBS from NMC Kolkata and has done her post-graduation in pulmonary medicine from SNMC College, Jodhpur. She's also honed her skills with an ERS fellowship for EBIS from Amsterdam. With more than 19 years of experience of working in NCR and Kolkata in hospitals like Apollo, Fortis, CMRI, Apollo Gleneagles also, she is now presently consultant pulmonology for Fortis Hospital, Anandpur. She has to her credit several national and international publications and is a certified ACLS instructor and conducts workshops on medical thoracoscopy and EBIS. I welcome you, Dr. Unithan.
Hi, Dr. Chupra.
Thank you. So today, Dr. Unithan, we have been grappling with COVID for last, I would say,
2 years.
2.5, more than 2.5 years now, because it started in that early Wuhan and all that. And then, I would say ABC, Alpha, Beta, Gamma, Delta, now we have another strain coming from the lesser privileged countries of Africa, where I think, again, the developed nations failed to give them that vaccination strength where these numbers surged. But now these numbers have become a scare for the whole world. I have that deja vu of, again, a new strain coming, again, people, travel restrictions, people stranded on the airports, and a lot of uncertainties about. So my first question to you is, why this strain is changing and what is so special about this strain?
See, the fact that this is a new strain, this is a strain of, this is a variant of concern. So WHO always it tries to classify any new strain, whether it is variant of interest or whether it is variant of concern. Variant of interest means whether there are mutations which need to be worked up, which might cause some disease, and variant of concern means this is something that has the potential of causing pandemic. So the fact that mutations occur in virus is nothing new. We all know that. In fact, when COVID-19 was first described, everybody, all the epidemiologists and all of us doctors, we were scared of the fact that there will be mutations. How bad is the mutations going to be? How long are we going to see these mutations is what our concern was always throughout. So Delta variant was a variant of concern, and we know what we went through in our second wave in India. We are still not very sure whether we are in the third wave or not. But yes, this Omicron variant, which has already entered our country, is going to cause the third wave. And this is a variant of concern, as the WHO has rightly pointed out. And because of the mutations the number of mutations, especially on the spike protein. The spike protein, as we all know, now almost everyone on the earth now knows what spike protein means. So the spike protein is the one with which it lodges in the cells. So spike protein mutations are what the virus is trying to do whenever they want to evolve, because the virus does not want to die. The virus does not want to disappear. So for its own evolution, it will always try to do all the kinds of mutations which will help in lodging itself to the host. And this particular variant has those mutations and significant number of mutations. So definitely, and this is causing a lot of transmissibility. The transmissibility is very high in this mutation. So yes, we must be concerned about it, and maybe some mild lockdown measures should help. Maybe, this night curfew, crowd restrictions, that should reduce the peak and the spread of the virus, as we learned from the Delta variant. by June, July, we were able to curb the virus, this Delta variant virus, with these few mild lockdown measures. So probably that will help us with the Omicron.
So my next question is, you आपने बहुत अच्छे से समझाया कि spike protein is the only vital thing which keeps the virus alive, क्योंकि spike protein से ही virus cell के अंदर आ सकता है, और क्योंकि वायरस एक पैरासाइट है, वो खुद सर्वाइव नहीं करता है, जब वो सेल के अंदर आता है तो सेल की मशीनरी पे सर्वाइव करता है। तो वायरस अपने सर्वाइवल की लड़ाई लड़ रहा है और हम अपने सर्वाइवल की लड़ाई लड़ रहे हैं। But now, having explained this in a very simple manner, but there are people who are averse to this lockdown measures, and it's not good for the economy also. We know it's good for us. But there are people who will argue, oh, so many Indians have been vaccinated. There is a herd immunity there. The zero prevalence of the major cities have gone beyond 95%. How do you think that these things are they defenses against Omicron or not?
So Omicron, as you know, this is it's just 1 month old, or not even 1 month old. So in the last few weeks, we are seeing that it is being, I think it's gone into Russia, into some of the other countries, even Hong Kong, in India. But wherever it has gone, so far what we see is the disease severity is low. Transmissibility is very high. Probably it's because of the gap between the infection into the body and the manifestation of the disease. That is slightly longer than the other variants. So possibly that is why the transmissibility, the person who has it inside doesn't know yet. The gap is so long that the person doesn't know that he has symptoms. When the symptoms come, by the time he has already spread it to more people. Probably that is why the transmissibility is so high. Usually what we have seen is those viruses that have high transmissibility, their killing power is low. Usually. Now
Right.
with COVID, we don't know, we are learning things, new things, but we are hoping for the best. More so, we are seeing that it is not still being able to evade natural immunity. Those who have acquired coronavirus naturally, with that, the amount of immunity that these people have, this virus has not been able to evade so far. Those who are unvaccinated, not had a disease before, it is they who have been infected with the Omicron virus, most of them, most of the younger people. But, sorry.
Yeah, there's.
Yes, I've come back. So, but it has evaded the vaccine-induced immunity. In some cases, it had. So we are not very sure whether the immunity that is being developed with the vaccination, whether that is going to be enough against Omicron. That is left to be seen. But that said, Delta virus is still there. The Delta variant is still there. The cases right now, the number of cases that we have, all of them who are coming back to us, all of them are Delta variants. So we have to keep ourselves vaccinated. Those who haven't been vaccinated yet, please go back. And the minimum civility that you can show is wearing a mask when you go out. Okay.
Can you take care of that, please?
Rahul.
Yeah, I think the message is very strong.
No, I didn't complete it there. I just today my secretary was telling me that she was coming. She goes back and forth in the bus, in the private, the public transport. Yesterday, it seems she had to literally quarrel with a lady for not having worn a mask, and she and the other person was like, "You are wearing a mask, so why should I wear a mask?" This is the kind of attitude. This attitude is never going to help. It's not going to help in the individual level. It's not going to help in the society level. It's not going to help in the country level. It's not going to help in the global level also. we have to be responsible individuals. We have to be responsible uh, uh, human beings.
I completely take the message very, very strongly. And I would like to add here another thing, that because of the, as you said, the innate immunity which Corona has given, that also has been more so in the tier 1, tier 2 cities. The vaccine hesitancy is more in the hinterland, and also the exposure is more in the hinterland. So it is more important for people to realize that people in the cities and in the hinterland alike have to do masking, and that's the least you can do. Whenever I encounter such a situation, I tell them what happened with me in the second phase of in the wave in Delhi. My phone was like ringing continuously. We haven't seen one family where we have not seen deaths, young people dying. And I always tell people, please talk to one such family who have lost that life, and you realize how important it is to wear that mask. So I think, yeah, that's where the learnings will come. But again, coming back, you said that the severity is less, transmissibility is very high, and there is still a doubt, which I think ICMR is also working, whether the present vaccines are working again Omicron virus or not. Have you seen any in the near future? Have you seen any differences in the patient patterns, the way patients are coming in the OPD, IPD, and how it is, how the hospital environment is being affected by that?
The difference between Omicron variant and the Delta variant, are you asking?
Or
See, I personally, it's not coming to West Bengal, so at least microbiologically, we don't know that. But from what we have read through the last few press reports, Omicron variant, whoever have been infected, they've not had fever. They're having cough, they're having fatigue, they're having all kinds of other respiratory symptoms, blocked nose, but very few, in fact, none of them have had any rise in temperature. So that could be one difference. Not very sure. But otherwise, I would find it very difficult to differentiate between the two. Only time will tell. The next 1-2 months is going to be very crucial about this. In fact, I think the IIT Kanpur people, they have come up with this projection that we are possibly into the third COVID wave in the next early 2-3 months of next year, January, February. There's going to be a third COVID wave.
Well, the temperature, which was the screening measure for getting into any building, any hospital, now that is also not left. And I think again, the safest things is to enter anything is to have your vaccination certificate and to mask up. So again, a very strong message that get vaccinated and mask up. So let's come back to the second wave and its sequelae. What are you now after the second wave ebbing in June, July? What are the post-COVID, long COVID effects which you are seeing at this time in your practice?
See, the thing is, we are quite in last year. In fact, not just the second wave. Last year, from the first wave, we were seeing plenty of post-COVID complications, and it's just the mere mass that were affected in the second wave, which is showing more of our long-term COVID patients. Just a minute, I think my mobile is slipping down. Yeah. So long-lasting health effects in some unfortunate people, whom we call them as long haulers or long COVID people. Now, when do we call them long COVID? If you see that they are in this particular situation, there are effects of COVID-19 that is persisting 4 weeks, more than 4 weeks after they have been detected with COVID-19. Till 4 weeks, we would call it as part of the COVID-19 disease. But if it persists beyond 4 weeks, that is when we call it as a long COVID syndrome. So we have plenty of breathlessness. There is persistence of cough, chest pain, palpitations. There are some people who have insomnia, depression, anxiety. There are some people who come with headache, which has persisted. Loss of smell and loss of taste, it's persisting for weeks, months together. I have had a patient who at the end of his 7th month, he calls me up and he says that now I can smell my perfume. So I just told him, now go and have a party. So there are people who are coming back only with dizziness. We are trying to find out, we are doing CT scan, we are doing cervical spondyle, X-ray. Everything is ruled out. So we know that is because of the long COVID, a part of the long COVID. There are people who have fever that is persisting beyond 3 months, a low-grade fever, maybe in the evening. We are thinking probably this is tuberculosis. We are ruling out everything and not finding out anything. And okay, so this must be a part of the disease, long COVID. We have yet to, there are many things that we need to document and, make, what do you say? This needs a lot of research. Maybe 3 or 4 years down the line, we will be able to name these symptoms that we are seeing. Some people are coming back with joint pains, with all the rheumatoid, the joint related, whatever problems we have seen so far. We are seeing all the markers coming out to be negative. So some unfortunate people, they have severe organ damage. They are coming back with kidney failure, brain stroke, heart problems. They've had a heart attack, or maybe inflammation of the myocardium, of the heart muscles, which we call myocarditis. Their heart rate is becoming irregular every now and then. So these are the kinds of problems that we are seeing. And lung problems are completely, that's a different chapter altogether.
So we know that this was an inflammatory process. जैसे हम बोलते हैं कि सूजन हो जाती है और सूजन होने के बाद फिर scar होता है. And when lung scarring happens, that's what we call lung fibrosis also. So did you see that there was some residual fibrosis or lung scarring of the tissue, and were these people then dependent on oxygen or non-invasive ventilation and all that? Did you see a subset of such patients also?
Yes, of course. When you say inflammation, when we say that is, as you said, सूजन, जब आपके एयरवेज में या स्किन में या किडनी के टिश्यू में या हार्ट के टिश्यू में जब आप देख रहे हो कि सूजन हो रही है, there is inflammation. So there are some cases, unfortunate people, mostly in children, I think they have seen more, and we have seen in adults also, which we call as multi-inflammatory syndrome. जो आप multi-system inflammatory syndrome जो है, इन पेशेंट्स में तो बहुत सारे कॉम्प्लिकेशंस होते हैं, बहुत सारे, जो मैंने whatever the number of symptoms that I told you a few minutes ago, these people, they are people who have 4 or 5 of them together. And in lungs, as you say, in lungs, yes, first of all, these patients come to you with, I'm talking about sicker patients, not the ones who have who are at home and have been managed on home isolation. Those patients who need hospitalization means most of them have had pneumonia. So in pneumonia, what happens is the inflammation is in the air sacs, जो थली, जो छोटे जो bubbles की तरह जो होता है, which is making up the lungs. So air sacs, they get inflamed. There is a lot of fluid inside. Air sacs के चारों तरफ जो छोटे blood vessels है, there is a lot of leak because of this COVID-19 virus infiltrating the blood vessels. और वो थलियां जो है वो सब एकदम भरे पड़े रहते हैं with a lot of fluid, which is why oxygen घुस नहीं, मतलब ये नहीं कर पा रहा, it cannot penetrate. तो लंग का जो मेजर जो काम है of taking in oxygen, वो नहीं कर पा रहे. जो हम लोग जो ट्रीटमेंट कर रहे हैं, with most of the people जो ट्रीटमेंट हम लोग कर रहे हैं, उसमें ये जो फ्लूइड जो accumulation हो रहा है, जो इन्फ्लेमेशन है ये सब सबसाइड कर जाता है. And around 80% of our patients, they go back home absolutely with clean lungs. But there are a subset of patients, जो 15-20% जो है, who ये जो है एक परत जम जाता है. Those जो membranes है वो thick हो जाते हैं. And there is a lot of scar tissue जो आपका कहीं कट जाता है तो जो white color का जो ये होता है, जो tissue बन जाता है, that white, there is a lot of scar tissue around. और ये scar tissue कभी normal tissue नहीं है. It is not as elastic as the normal tissue. तो वो एकदम जकड़ के रख देता है और फिर वो thick रहता है तो आपका ऑक्सीजन वैसे भी नहीं घुसेगा. जो एसेक्स आपके इससे भरे हैं वो उस दैट इज वो कम गए कम से. नॉर्मल जो लंग्स है, जो पार्ट है, उसी से आप काम चला रहे हो. सम पेशेंट्स वो जो नॉर्मल पार्ट है दैट इज इनफ फॉर देम, उनको ऑक्सीजन की जरूरत नहीं पड़ती है. बट देयर आर सम पेशेंट्स जिनका सिर्फ थोड़ा बहुत इधर उधर नहीं, ऑल ओवर the entire two lungs they are affected. The entire lungs as a whole they become stiff, जिसको हम लोग बोलते हैं ARDS, acute respiratory distress syndrome. आप लोगों ने बहुत सुना होगा कि इस पेशेंट को वेंटिलेटर में दिया, 5 दिन 6 दिन 15 दिन निकाल ही नहीं पाए, कुछ इन्फेक्शन हो गया, सेकेंडरी इन्फेक्शन हो गए, and ultimately they have succumbed. Some people they have come out. जो survivors है, they are surviving but they are suffering also. इन stiff lung को लेके उनको जूझना पड़ रहा है. They are having to breathe with that stiff lung. Some of them with huge mental क्या कहते हैं strength. They are doing their physiotherapy, वो जो physiotherapy करते हैं, I get I get inspired seeing them. They are hardly being able to take 150 or 200 ml air, but they are doing it. And जिन्होंने किया है, ठीक से किया है, they have all come back after 6-7 months without oxygen and managing well, most of them managing to go back to their work. So yes, we have seen a lot of ARDS patients. ARDS may, I must say 65 to 70% patients have, they have expired, but those who have survived they are struggling, but making it. Most of them are making it.
So viewers, if you are listening to Dr. Unnithan very, very sincerely and attentively, then you will again realize the benefits of masking and vaccination. So please make it a point that you don't land up in such a position where your lungs
Absolutely.
Right. I have seen many such cases and बहुत ही simple सा example अगर मैं दूं तो हमारा lung एक sponge की तरह है और जब आप sponge को press करते हो तो उसमें से सारा पानी निकल जाता है. Just imagine कि अगर sponge soap की तरह हो जाए कि वो उसको आप press ही नहीं कर सकते हो and there is no oxygen. Basically आपका lung ही आपको अंदर oxygen नहीं दे रहा है तो आप बिना oxygen के कैसे survive करोगे? So again, but interestingly, Dr. Unnithan, you mentioned physiotherapy and rehabilitation. So what do you think is the role of a proper rehabilitation, whether at home, whether in an inpatient rehabilitation center where you have trained respiratory therapists, pulmonary therapists, and all equipment required to manage patients? What's your opinion that how does this help patients?
So, as I said, what our post जो survivors जो भी हैं, जितने survivors हैं, severe जिनको pneumonia हुआ है, severe जिनका ARDS हुआ था, lungs, किसी का lung stiff है, किसी का lung airways एकदम पूरा ये हो रखा है, contracted हो रखे हैं. So ultimately post discharge, when the patient goes back home, the doctor and the respiratory therapist, इन लोगों का primary aim क्या है? To allow to क्या कहते हैं वो, उनका जो lung जो function है उसको improve कराओ. उनका जो एक्सरसाइज एंड्योरेंस है, एक्सरसाइज टॉलरेंस जो है, उसको इम्प्रूव कराओ, so that the person is fit enough to do his or her normal activities.
Right.
इतना ही तो कराना है हम लोग को, तो we are not going to make them run marathons and all. जो उनका डेली लिविंग एक्टिविटीज है वो फैसिलिटेट कर पाए हम लोग, दैट इज आवर मेन एम. तो जो हम लोग के आईसीयू पेशेंट्स है, इनको हम बताते हैं, जो आप लोग जो वायरस को सरवाइव कर गए हो, दैट इज जस्ट हाफ द बैटल. That is just half the battle. After they come back home, breathing difficulty, fatigue. Fatigue is one of the very, very common symptoms of those who have respiratory problems. Limited activity में उनको weakness हो रही है. That is because of probably वो लोग जो pulse oximetry कर रहे हैं, तो देख रहे हैं कि शायद 96-97% saturation है. But the effort that is being having the respiratory muscles, the chest muscles, आपके यहाँ के जो muscles है, they are having to take to just maintain that 96-97%. That itself takes a big toll on the body. तो इसके लिए हम लोग को we have to nutrition, energy levels बढ़ाने के लिए nutrition proper होना चाहिए. आपका इंसेंटिव स्पायरोमेट्री जो पोस्ट डिस्चार्ज सबको दिया जा रहा है, जहाँ पे बॉल्स उठाने का, डीप ब्रीदिंग, सिंपल डीप ब्रीदिंग एक्सरसाइजेस विल बी इनफ. वॉक इज वेरी वेरी इंपॉर्टेंट. आपको कार्डियो कुछ करने की जरूरत नहीं है, ट्रेडमिल नहीं, आप बस प्रॉपर वॉक कीजिए. सुबह शाम आधा घंटा नहीं तो 1 घंटा जैसा आपका एक्सरसाइज टॉलरेंस है, वैसे आप वॉक करिए. get your pulmonary function tests done. आप 6 मिनट वॉक टेस्ट करते रहो. keep a limit for yourself कि हाँ, हमको आज 1 किलोमीटर या 2 किलोमीटर चलना है. maybe you have to do it in divided phases, लेकिन करो. So this is the kind of, and respiratory therapist का तो काम है ही, जहाँ पे if it is a patient who has had these वेंटिलेटर पे थे, बहुत सारे इन्फेक्शंस हॉस्पिटल एक्वायर्ड हो या ऐसे ही नोज़ोकोमियल जो भी इन्फेक्शंस हुए हैं, जो उनके जब फाइब्रोसिस हो जाता है तो देयर आर मेनी एरियाज जहाँ पे कफ जम जाता है, तो उसमें आप फिजियोथेरेपी कर करके वो कफ निकालना, मोबिलाइज कराना. There are so many ICU patients who have been on the ventilator, have been on the bed, they have been bedridden for days together, 30 days, 35 days, 40 days. जब वो उठ के बैठने की कोशिश कर रहे हैं, they don't have the strength, the muscle mass भी चला गया, muscle strength भी चला गया है. तो वो mobilizing जो exercises है, these are all important.
Thank you so much. And it's such a coming from such a reputed doctor like you, it matters a lot when you say that the only 50% of the job is done when you move out of the hospital, where people take कि अब तो जान बच गई, अब तो अपने आप ठीक हो जाएंगे. And there is a very specialized team consisting of a physiotherapist, respiratory therapist, nutritionist, psychologist, right, who have to work with your primary doctor to get back you to recovery. That means you are able to do what you were trying to do before you went to the hospital. Right. So absolutely very, very interesting aspect which you have brought in. So one question which I'm very curious, and my viewers are always curious. You have done your fellowship in EBUS, right? Can you tell people something about EBUS?
That's a topic that is completely
just what is it?
So EBUS is endobronchial ultrasound. Endobronchial ultrasound तब जरूरत पड़ती है जब आपको when we do bronchoscopy, I don't know whether bronchoscopy is kind of a scopy, जहाँ पे आपका एक पाइप रहता है, एंड में कैमरा रहता है. So there are people who cannot cough out, तो इसीलिए हम लोग एयरवेज में जाके देख लेते हैं. कभी कभी कुछ ट्यूमर रहता है तो ट्यूमर से बायोप्सी लेना है. और देयर आर सम जैसे लिम्फ नोड्स होते हैं या फिर कुछ मास ऐसे होते हैं जो सांस की नली के अंदर नहीं रहता है, सांस की नली के बाहर रहता है, वॉल के दीवार के उस पार रहता है. तो हम लोग अल्ट्रासाउंड मतलब लुक एट द एडवांस मेडिकल एडवांस. अब सोचो एक छोटा सा एक पाइप के एंड में सिर्फ कैमरा नहीं रहता है, उसमें अल्ट्रासाउंड भी रहता है. तो आप वो अल्ट्रासाउंड से आप दीवार के उस पार क्या है वो देख सकते हो, देखते देखते आप वहां से सैंपल ले सकते हो. That is endobronchial ultrasound. So that's completely irrelevant. इसके
The
साथ
reason, the reason for asking that question is to give people the insight that what level of proficiency the medical field has gone in pulmonary medicine, and to what is such an expert today we have the privilege of getting our viewers exposed to.
I must tell you, ऐसे जब बात उठी है तो we have done bronchoscopy and EBUS on COVID patients also.
Oh, that's
Because ऐसे बहुत पेशेंट्स है जहाँ पे हमने देखा है कि सिर्फ कोविड नहीं, उनको टीबी भी है उसके साथ. So we have had to ये भी करना पड़ा है.
No, hats off to doctors like
And
you.
cancer भी.
Yeah, so hats off to doctors like you who were there on the front lines, are still on the front lines. I at times feel that the healthcare workers never got time to revive. There has been a lot of fatigue which was set in, and they never
Yes,
got.
yes.
And now this third wave is going to maybe create, if at all it happens, more maybe to create more fatigue, more problems. And still, every doctor, every nurse, every healthcare worker is still so much charged up to save more lives, right? So I must tell my viewer, yeah, you want to say something?
It's not just affecting us, it's affecting our family life also. So the entire thing is, it's percolating into the society. So which is why I keep, when I see there are certain people who say that हमसे मास्क पहना नहीं जाता है, मास्क हम सहन नहीं कर पाते हैं, दम घुटता है, तो हमको I get very angry. I said, listen, we are people who, मेरा यहाँ आप लोग तो अभी देख नहीं पा रहे हो, but I have a permanent scar here on my nasal bridge. We are people who are wearing this N95 mask पूरा एकदम sealed रख के, so that obviously for the kind of the work that we are doing the whole day, we are wearing this mask 12 hours, 14 hours, एकदम non-stop. We are opening it only because we will have to take some meal. और अभी मैं कर रही हूँ because I want people to see my face. But I am sitting in my chamber right now. तो हम लोग मास्क पहन के जब इतना कुछ कर सक रहे हैं, अब ये सिर्फ ये मास्क नहीं, जब हम लोग कोविड वार्ड में जा रहे हैं, we are wearing, इसके ऊपर 2 और मास्क होते हैं. तो ये डिस्कम्फर्ट हम लोग ले रहे हैं बिकॉज इट इज ठीक है, हम लोग का प्रोफेशन है, मानती हूँ, बट हम लोग भी बाहर जब हम लोग जा रहे हैं, व्हेन वी गो आउट, वी आर नॉट कंप्लेनिंग कि भाई सारा दिन तो हम लोग 12 घंटे तो हम लोग को मास्क पहनना पड़ा, अब नहीं करने वाले, करना पड़ेगा. वी हैव टू डू इट. दैट इज आवर रिस्पॉन्सिबिलिटी.
That's again, as I said, a very, very strong message from such a senior doctor. And I always request people that please, if you can't think beyond your family, think about your family. If you mask, you'll get infection, you'll infect your family, your children, your parents who are vulnerable, right? And you really don't want to do. For their sake and your sake, please mask up, get vaccinated. And with this, we come to the end of this session. We have reached to more than 1,000 people. We have had more than 400 shares. And at any given point of time, more than 50 people were live on our session. Very, very interesting, very, very intriguing insights, very, very inspiring, I would say. Thanks for enlightening us on the possibility of a third wave. I wish it does not happen. I wish the vaccination is strong enough. Nobody wants to see a wave again, but the people have to be careful and they have to have COVID appropriate behavior. Thank you so much for your time, Dr. Mithun, and thanks for being with us and enlightening our viewers. Thank you so much.
Thank you. Thank you.